Hello, good evening, and Happy New Year to you. It's 2025, and me and Dr. Saw are here. We missed a couple of weeks because Dr. Saw went up to he went to spend some time with his family in the UK. But we're here again, as we promised. We're going to do a new format from now on. What we're going to do half an hour of the topic, and then on the following week, we're going to spend half an hour discussing those questions that you would have posted on Facebook as you usually do. So, Dr. Saw, Happy New Year. You were in, I think you were in the US.
At the moment, yes, I am. Thank you, and Happy New Year to you as well, and to the viewers.
How you spend your holidays, man?
The holiday was okay to an extent, but we were also taken back by some sad news after the holiday. That is, a friend of mine, a daughter died, so I ended up traveling to the US for that funeral. I want to really, at this point, to extend my condolences to the family and to say how shocking this was to all of us. And I know that by extension, lots of other friends and families have reached out to me and find out about, what's going on in terms of, the funeral. But no, it's really heartbreaking when you have a young person died. And as part of health, I really want to touch a little bit also on that, because it's really, it breaks my heart, and I don't think words can express the way I feel for this child. And sometimes, we have our loved ones and our children always. We try to, guide them and create boundaries for them and so many things. And at times these things are misinterpreted.
Yeah.
And children go through different things going on in their head. We don't know. We will never know. But I would appeal to parents and everyone out there. Yes, talk to the youngsters, young and old, all alike, but try to talk to people to understand, what is going on, how they're feeling, ask the question. If you notice anything unusual, reach out to them. And I think communication is a big deal, and showing love and affection and that you care. And I think that can change things in so many ways. But yeah, so I'm here, and that's why I'm doing this from New York. And next week I'll be back in the UK, and we'll continue. But yeah.
Well, I'm sorry that it's a solemn occasion that you had to travel over there for. But as you rightly said, sometimes these things are a little taboo sometimes because nobody wants to talk about them. But we can only be our brother's keeper in every way, and we need to look out. We need to call up somebody, find out how they're doing, because sometimes what I've realized, Doc. I deal with a lot of people in this. Some of the programs that I do most of the programs that I do in mentorship and so on is one-on-one, and a lot of times I talk to people. I remember one girl who reached out to me some time back, and she was on the verge of suicide, man. And she said, my life is done. And thankfully, last year she graduated as a valedictorian in her course at NYU, in right where you are in New York. So NYU Medical. So yes, I think that we all have that responsibility to look out for people. Maybe not just family, but sometimes just a random stranger just needs an encouraging word. Yeah.
It's always good to find out how people are doing and keep check. I think that's important.
Yeah, Doc, some of the reviews that we've got from our show from last year were excellent. Well, we've only had good reviews, and I think that we are on the right track here also to provide information to the general public on health and livelihood. So tonight we're going to be talking a little bit about
blood in the stool.
Oh my goodness, blood in the stool. Yes. Yeah. We're going to be talking about blood in the stool, rectal bleeding. That's what you call it, right? So, Doc, first of all, what is rectal bleeding?
All right. As we know, the anus, that's part, the rectum and the anus is the back passage, as we call it. And it's a very common condition, and that is why I said, okay, we can start with some symptoms and signs that patient present with, and then decipher that to understand a little bit more in detail what are the possibilities. And as it says, blood in the stool. So what it is, you see blood in the toilet, in the pan, or on the tissue. And in lots of times, patients are not sure, where is this coming from? Is it on my skin when I wipe myself? Is it in my bowel that is coming from? And in women, sometimes they can wonder, is it coming from the vagina area? So it's important to establish exactly where it is. But we are going to zoom in specifically that we have identified that this is coming from the back passage, and that is anus, rectum, anus. So after the rectum is the anus, so that's the exit, right? So as you go higher up, you get the rectum, and then the colon as you go up into the tract, the bowel, right?
Yeah.
So when you see, you go to the toilet and you pass blood, you would see red blood as in proper blood. There are two types of blood you can see. You can see, what is the two types? Blood is blood. But it looks differently.
Yeah, coloration.
So blood that is digested a little and it looks a little bit dark, like old blood, like clotted blood.
Yeah.
You have bright red blood that is fresh blood. And sometimes it's a giveaway to say, right, this is fresh blood, right, let's see where it's coming from. If we know this is old blood, as in clotted blood that is a little bit darker, you can say, fine, this probably been around, lying there, and then it comes out when you open your bowel. Right, so sometimes that's the kind of thing you look for. But it's a common condition and people get worried. The first thing that comes to mind when people see blood in the stool, well, in this time and age, when I say to you earlier that the two most common causes of death would be cancer and heart disease. Cardiovascular disease and cancer are the two most common causes of death. So once you see blood in the stool, you start to panic. You want to know if this is cancer. And rightly so, it is important to establish that. That's not the most common cause, however, so I don't want patients to, as soon as they see that, they worry that this is something dangerous. We always think about the worst. But there are other causes, and that's why I will, go through them.
Naturally, we as human beings, we tend to think to the extreme a lot of times. But you speak about, when you talk about the older blood in the coming out in the system, could that be so although I know people who has stomach issues, right, would be having bleeding within their stomach, varicose and that kind of thing, right? Yeah, especially if you got issues with the liver and so on. Could the older blood be from that also, Doc?
Correct. So it will present like that, but sometimes you can't recognize it as blood. So when blood comes from the stomach, it has to go from the stomach, which is higher up,
right,
down to the bottom, so it gets digested. And what tends to happen, when it comes out, comes out dark.
Yeah, almost black.
The stool gets black.
Yeah.
So with a black stool, you could say that may very well be stomach bleed that get digested and it make the stool black. So that is usually what you can get. But when we see blood, proper blood that you identify as blood, bright red blood, we're looking for conditions of the lower passage. So we'll go through those conditions.
Yes.
Now, first and foremost, the most common one would be local causes. So the first thing you want to know is conditions around the anus. And what are the conditions around the anus that can give you blood, bright red blood? So either the blood is in the pan, so they poo and they see the blood in the pan, or when you wipe yourself, you see the blood. And a common cause would be hemorrhoids. You heard of hemorrhoids?
Yes.
And
is it, Doc, let me say, is it the same thing we refer to in Guyana as pile?
Absolutely, yes.
Right, just clarification. Piles.
Yes,
yeah.
Likely. Piles and hemorrhoids, they're the same thing.
Yeah.
So what it is varicose veins, like how you get swollen veins in your leg. People get varicose vein. Most people know what is varicose vein. The veins are swollen and enlarged.
Right.
You get that in the back passage as well. And for various reasons, we don't know why you get varicose vein. There's a combination of factors. You can get it because genetically your veins are weaker. You can get it because patients who stand for long periods, they get more pressure in the veins that goes down. So for various reasons you can get that. If you strain, you strain, you put pressure on the veins, so you get that. So these are veins in the back passage, the anal passage. It gets swollen and they get inflamed, and covering the vein you have what we call anal cushions. And there are tissues that covers the vein, and when those things get inflamed and it protrudes out, that's your piles. Now, piles are further divided into external and internal. External means, as it rightly says, it's inside.
Yeah.
Internal, as it rightly
inside,
says.
Yeah.
External and the outside. And it just goes to show, it is explained by where the which blood vessel is affected. You have higher blood vessels and you have lower blood vessels. So depending on where it is affected, that's how you will get a protrusion. But also the extent of the protrusion. So you may have one that is higher up, but it is so big and swollen and hanging down that it protrudes outwards. And the other one might be just around the anus, passing the exit, and that pushes out. So most of us know what is piles. What it is, you'll feel a lump, generally. Externally, you can see it if it protrudes out, and there are different degrees of it. Grades of it. First degree, second degree, third degree. Some of them comes out, it gets stuck, it doesn't go in back. Some comes out when you strain, it goes back. Some comes out and you have to push it back yourself. But the whole idea is that the veins are swollen, the tissues around it are swollen, it's inflamed, you get pain, and it bleeds. Now, there are triggers generally, and some of the triggers would be straining, or even if you have normal diarrhea or going to the bathroom, toilet many times. So you put in pressure every time you go, you push in. So if you go 4, 5, 6 times on that day and you already have piles, that can flare it up. You eat certain food and you get diarrhea.
Right.
It can flare it up. You strain, coughing, certain things can cause you to strain, constipation. So you're straining when you go to the toilet, you're constipated. You can aggravate your piles. That is already there. But in terms of the cause, there are many multifactorial. There's genetic susceptibility, and there's some external other, like constipation causes. Anal pressure is high, it pushes out on it. So these are the causes. And yeah, that's a common cause.
So that's hemorrhoids.
Hemorrhoids. Okay. So the symptoms would be bleeding. Either in the pan you see it bright red, or you wipe when you see blood. It may or may not be painful. So some of them, when it's internal and it's inside and it's high up, you might not get any pain. When it's swollen and protrude out and the blood is clotted inside, we call it thrombosed, you get pain. So you get anal pain, you get bleeding. So the cardinal signs and symptoms: anal pain, bleeding, and you may find a swelling. And that's your pile. So that's one of the common causes. The other thing, there's something called anal fissure. Anal fissure is an ulcer. It's a normal ulcer. Ulcer is like a wound, like a cut. So as the back passage, there's an ulcer on it, and it can cause bleeding. The thing about anal fissure is very, very painful generally. So as a stool, so when you strain, you get hard, you're constipated. The stool is hard. It comes down, it bruises the back passage, and it can cause bleeding. And also it's very painful. So the treatment, they're different. So we'll go through that a little. So anal fissure, these are what we call local causes. So you know that there's something there. It's localized, giving you the blood. You have other conditions of the perianal area, like abscess. You can have an abscess. People get like what we call hard boil.
Right. Yes.
So that's an abscess. You can get an abscess around there. And usually you can get a bit of bleeding, but also you can get pus coming out with it. And it's when you have an abscess, you'll get blood stain stuff, but you will know it's an abscess because it's a bit swollen, it's more painful, and you get pus. Usually with piles, you don't see pus. Whereas if you see pus, pus.
Yes, that's right. In Ghana here we just call it inflammation. The thing got inflammation, right? Yeah. So and the reason why I like to use these common local terms is because so that people can understand exactly what is it that we're talking about.
No, absolutely. No, that is important. And there's a condition, there's a type of another kind of infection besides that abscess in the perianal around the heart. Sometimes the abscess has a mouth on the outside, and internally it also has a mouth. The mouth.
Right, exactly. Yeah.
Where the pus will drain.
Right.
So you can see it on the outside. Anyone who's got an abscess by their back passage, it could be something deeper than just a normal abscess.
Mm-hmm.
Because you can get a mouth on the outside, and internally there's a track that goes through the abscess, and it goes all the way and it opens up into the rectum.
Oh, okay. Wow.
Right?
Yeah.
That is called a fistula.
Right.
So this is an abscess, an infection. You get a mouth inside and a mouth outside.
Mm-hmm.
And that's the kind of abscess that don't heal.
Right.
So if you have a normal abscess and it bursts and you squeeze the pus out, open it up, you'd expect in a couple of weeks you get better. But you have people who would have a drainage of blood stain, pussy stuff for months and years. And they are told, oh, it's an infection. And sometimes they don't really pay much attention to it, but there's a different way to treat that, because that is called a fistula. And it just is like an abscess, but it travels internally. Mm-hmm. So when you fix that, you have to go and open up the whole track and lay it open, and there's different surgical procedures. They put beads inside, they can put a little bit of string, like impregnated with antibiotics and stuff like that. So there are loads of different ways you could manage the condition. So that is called a fistula. So we get hemorrhoids, we've got fissure, that's ulcer, and you've got fistula, and abscesses, that's your perianal area.
Yeah.
So that's blood. You could get blood or blood stain product in your stool. But also, as you go higher up now, of course, I said to you that cancer is a common thing.
Right.
So you want to exclude anyone with blood in the stool. You want to make sure it's not cancer. Now, cancer will present. Of course, you may have painless bleeding. When you examine patient, you can get a mass so when you put your finger up, your finger is only 2-3 inches.
I 3 inches. Average. Yeah.
Average, right?
Yeah.
Remember, you're only feeling that 3 inches.
Right.
But something could be higher.
Yes.
And you can't feel it. And that is why we sometimes put a little camera.
Yeah.
So if you put your finger and you feel a lump, or you feel that there is some tissue there that doesn't belong there, then you would know this could be cancer, that is a tumor. And the tumor could be anywhere from right at the bottom, anal, rectum, or you go high up in the colon. Mm-hmm. But to see the colon one, you have to put a camera. The anal one and rectum, you can probably feel. When you figure, you feel like there's lumps in there.
Right.
And then right, there's a mass there. You might have to go and take a sample and then see that it is not cancer. But importantly, you want to make sure that blood in the stool is not cancer. But most of these patients would come in with other symptoms. If you have cancer, sometimes, if you leave it for too long, you start to lose weight. It changes. So the signs of cancer that we look for would be change of bowel habit. That is important. So if somebody used to go to the toilet every day and suddenly they start going every 2-3 days, we take that as a sign. That is called change of bowel habit. So if you have change of bowel habit and you have blood in your stool, without a doubt, you need a camera.
Okay.
Right? So that's an important thing. 1 second, let me just... Yeah. Then also you can lose weight. So cancer, as you know, it can make you lose weight. So, yeah. And of course, the management, that is, you then go investigate and you manage that according to cancer. What else we have? Diarrhea. Normally, diarrhea by itself, any infection of your bowel can give you blood in the stool. But that would be characterized by bloody diarrhea. So that can just be an infection.
Okay.
So when you get conditions like something called Shigella, Campylobacter, any gastroenteritis type of condition, you can get a bit of blood in the stool. But more importantly, if somebody come in with blood in the stool for months and months, and they have diarrhea associated with it, what we want to make sure is that you do not have a condition called inflammatory bowel disease.
Oh.
And there are two important ones. They're called Crohn's or ulcerative colitis. Have you heard of those conditions?
No, doc.
All right. Right. So Crohn's and ulcerative colitis, they're special condition described as inflammatory bowel disease, and the word explains it. It's
Right.
inflammation of the bowel.
Yeah.
So the lining of the bowel, so you got a bowel is a tube, let's say. Internally, there are different tissues in there, mucus, we call it mucous membrane, and it's inflamed, and you can have ulcer formation. It's red, it's inflamed, there's ulceration. So when you go to the toilet, the whole area that is inflamed is bleeding,
Right.
and you get. So that is an important condition that we want to find out, because lots of these patients end up losing weight. And of course, it's annoying. You normally would go once or twice, and you end up going 5-6 times. You get tummy pain with it. You can get infection. You can get abscess formation, and all of that. So those are the common conditions that we would talk. I mean, that come to mind when we look at blood in the stool.
Right. Doc, look, while I'm one for alternative medicine, there are some things that you hear sometimes that would kind of make you think twice whether it really makes sense. And here's why I'm saying it. I remember growing up, somebody had, I knew a couple of persons who had hemorrhoids, and I remember hearing that somebody telling somebody else, you might find it strange, but you must have heard it, that you need to eat eggshells. And if you eat eggshells and you pass it out, it's going to cut this thing out. It's going to cut it as it's coming out. I don't know if you ever heard that before.
Not really, no.
Right.
No,
So I'm sure our viewers...
That's the logic that you're saying.
Right.
So one of the treatment for hemorrhoids is to cut it out. But there are different ways to treat it.
Right.
So you get hemorrhoids as a little lump with a little pedicle. So you can go and snip it out. But what they do, they can tie a rubber band on it. So you band it.
Yeah.
And it falls off.
Yeah, you naturally starve it from...
Or, because I said it's a blood vessel that is swollen,
right,
we can inject something in the blood vessel and it shrinks the blood vessel.
Right.
And nowadays they have laser type of thing. You can put a probe in there and it coagulates the blood and it's called ablation.
Right.
The blood vessel. So these are procedures, lots of surgical procedures can be done.
Yeah.
And then in severe cases, the extreme ones, we go and do proper knife and cutting.
Okay.
You just cut the tissue out.
Yeah.
I mean, that is less done these days because we have more advanced technology that people pick it up earlier, they manage it better, and they have more access to doctors these days than 100 years ago.
Yeah.
So we don't find them at the extreme stages nowadays. We find it, earlier people would present to their doctor and they get it managed better. But the actual thing I haven't heard of, but the logic
it just came back to my mind as you were talking about it, that this situation.
I would imagine is like, you can take anything that is sharp and it goes down your stomach, but I find that a little bit.
Yeah. It's just, yeah.
In my opinion, that is far-fetched.
Right.
And I don't think the logic holds that. How do we know it's coming down in such a way that they will snip everything?
Right, exactly. And you see what happened, Doc? Look, these things, a lot of people, people are embarrassed by these things. They don't want to go to doctors, so they seek an alternative treatment that somebody tells them about. So they decide they're going to try it. I guess they might probably get eggshells are good, high in calcium. You might just get a good calcium boost. But as I said, the reason why I bring these things up on our show, Doc, because people generally wants to get help. Everybody wants to get help with whatever condition they have. A lot of times, people would try these alternative treatment, right, to see if it helps, right? But again, the best thing to do is to go see a doctor. There's nothing wrong with that.
That's absolutely right. Yeah. So, but some of the things, like if I were to tell patients, like, when do you worry, when not to worry? If somebody say to me, they're young, 20s, and they have had bleeding on and off for 2, 3 years, 4 years. Yeah, that's the thing with hemorrhoids. You will get bleeding today, and you strain for a day or two. You see blood in the tissue or the pan, and then it stops, and you forget about it for a whole year or a whole 6 months.
Right, right.
And it comes again. Now, and you're young, let's say in your 20s or 30s, I would say that is likely to be hemorrhoids.
Okay.
Because if it was something more sinister, like cancer, it would be more progressive. So today it's there, tomorrow it gets worse, next day worse, next day worse.
Right.
And it will manifest itself. But I wouldn't expect cancer to present where you have it today, you're better for 2, 3 years, and then you have it again, you're better for 2, 3 years, you have it again. So if you come with that history, so the story is very important. When you have a history like that, right, you get on and off bleeding for 2, 3 years, and it's bright red, and when you strain it happens, and something you feel a lump, that's classical hemorrhoids. And it doesn't turn into cancer. Hemorrhoids wouldn't turn into cancer. So you could say, fine, I would treat it with not to get constipated. We can take painkillers. There's something called a sit bath, where you warm bath. Now you sit in a warm bath.
Okay.
And your painkillers, and then you would use, they're anti-inflammatory, so they get a bit of steroid, and they have some anesthetic drug on the cream.
Right.
So most of the cream, it's a combination of some anti-inflammatory, which is steroid cream, with analgesic, painkiller, local anesthetic. So when you apply that, it takes away some of the pain, and then it works as an anti-inflammatory, and it shrinks it. And people are good. Sometimes you get a flare-up, and then you treat it, you're better. But if you want definitive treatment, that you want to get rid of it completely, then you have something a bit more surgical. Either you band it, you remove it, you inject it, you coagulate it, ablate, that kind of laser thing, or you have an operation where you cut it. So these are the procedures. And a lot of people, they have the surgery, and they may come back a couple of years after, and they say, doc, it wasn't done properly. But that's not necessarily true. That particular one was done properly, but because you have a predisposition for it, you may get a new one happening.
Okay.
Because you got lots of blood vessel there.
Right.
So today I may remove one and fix that one, but then next day, or next month, or a new one starts. Yeah.
So, viewers, I'm sure you're finding this very interesting. As I said, we are doing it in a new format. So tonight we're just doing half an hour, and then you ask your questions next week. When Doc, you're going to be back here in Ghana next week?
Not next week. No.
Okay. So we'll do it right on Zoom.
Done, and we'll continue it on Zoom. So yeah, indeed. So what I would like patients to do is that they comment on what we're talking about, and then they send their questions. Ask any question, and it doesn't have to be on this topic.
Right, exactly.
Any question whatsoever. So when we address it next week, I will still give a half an hour presentation on a topic, because I want that to be educational.
Yes.
So we talk about something educational that, patients understand a little bit more about their health. And then I would address those questions in the second half of the program.
Indeed.
Isn't that the format we want to do?
Yes, that's the format. Doc, there's something else I want to ask you about, as it relates, when you have these conditions like an inflammation of the bowel and these kind of things, it may present pains, discomfort and pains, right? A lot of times here in Guyana, again, I'm going back to this because we need to look at these issues. You spoke about inflammation of the bowel. I would want to think that these conditions present themselves with pains, tummy aches, and these kind of things. One of the things that I know that happens, at least when I was a kid, the moment your belly hurting, is that somebody says that you got NARA, and you know what NARA is. You probably can explain exactly what NARA is, because I myself don't really know. But and then they would say that they want to massage. Then they would proceed to massage the tummy area. And some people go very deep in, because I remember as a kid, my grandmother used to, this thing would hurt so much when she's doing that. But somehow or the other, we felt better. But should somebody have this condition of an inflamed bowel and you apply that heavy massage to it, could it cause more problems? And what do you have to say about that?
So a couple of questions there you asked.
Yeah.
One, what is NARA? So I don't know. I know NARA. I grew up in the country, so I know what is NARA. So my understanding of NARA, I may be wrong, but I suppose there's a Hindi word. I don't know where it came from, but we weren't taught NARA in medical school.
Right.
But my understanding of NARA would be you're getting pains in your tummy that is coming from your bowel, your intestines.
Right. Yeah.
And in the explanation of that would be you're getting a spasm of the muscles of your bowel. So we're not talking here, when you talk about tummy pain, you can get pain from the muscle outside.
Yes.
And that is a different type of muscle.
Mm-hmm.
The muscle in the internal of your bowel, so we have what we call skeletal muscles in your arm and your walls of your stomach, of your abdomen. It's called skeletal muscles. There are different types of muscles. The muscle in your bowel is called smooth muscle.
Okay.
And then you have cardiac muscle, the muscles in the heart. So all these muscles are different. They have different structure. So the muscle in the bowel, they're smooth muscles and they contract differently, and that's what gives you NARA. So we describe NARA as spasm of the bowel. So you get colicky type of pain. Colicky pain means it waxes and wanes.
Right.
So it goes up and down. You get these sharp contractions, and that's the kind of pain patients describe, like when they have a labor. Same, you get smooth muscles as well that contracts, and you have the pain that goes and comes, right? So colicky abdominal pain is what is described as NARA in my understanding. And of course, yes, in the country or in the villages, they will go and massage it. Now, my take on it, to be honest, I advise against it because I don't see any medical evidence to substantiate that. Now, it is okay you have a pain in any part of your body, you can have a soothing, a little
light
bit of a
massage.
soothing massage. So if I were to just, soothingly try to soothe things out, it may feel a bit better. But for you to do deep palpation that is deep pressing, and I had that massage you're talking about. It was, in our village there are people doing it, and my grandmother as well. They used to massage you, and they press deep into your stomach.
Right.
So this thing's painful. But I would advise against that, and I tell you incidents that we have had where patients have appendix.
Right.
Appendicitis.
Yes.
And I know of a patient that died from somebody pressed the NARA, burst the appendix. And they still kept that person thinking it's NARA, and the guy get septic. So when the appendix bursts, it's pus coming out. So your whole tummy now, you remember your colon and it's a crack.
Yeah.
When that bursts, it opens out your bowel, sort of.
That's right. Yeah.
Air, pus, everything, and mix up in your whole abdomen. And that's a very serious infection. It causes something called peritonitis, and you can get septic and you can die. So by all means, no. And also when your stomach is inflamed, as you said, those inflammatory bowel disease, Crohn's, ulcerative colitis, we advise against massaging in that way. So if you're not sure, see a doctor. No, don't go and have your deep massage. A soothing little touch and superficial soothing thing that will relieve some of the pain in that way. But no, if you don't know the diagnosis, please see a doctor, get it properly diagnosed.
All right, Doc. You know what? Our time is up again. So time flies out so fast. But thanks again. And this is a very important topic that we're covering here. We're starting off the year with this, and viewers, as Dr. SAWH would have mentioned, and I would have mentioned, based on our conversation tonight, send in your questions right now, and we are going to answer those questions next week. We are going to continue this format where we're going to have a half an hour of of educational program where we talk about medical topics, and then the next half an hour is while we continue to talk, we're going to answer your questions too. So again, thank you so much for joining with us. Happy New Year to everyone. We look forward to a healthy 2025. Doc, I can't wait to have you back in studio. It feels better having you sitting right next to me, not being so far away. But I understand. I hope that the family that you were talking about earlier, that they find some comfort in you being there with them also, because I know you're a good guy. I know that you will try your best to help. So anything you want to say to our viewers before we close off tonight?
No, yeah, thank you, Akash, indeed. And yeah, to the viewers, I think, yeah, we want to continue our program as we are. And indeed, again, I would appeal to people, look out for each other. Always, show a caring attitude towards people. And yeah, let's continue in that streak.
All right. So viewers, thank you again for joining us. Remember, I always say on this program, we have too many accidents happening in Guyana. Here, you could for the year, it probably gone past the days, and probably got more than 30 or 40 or maybe 100 so far. We gotta do better. Look out for those who are looking out for us, and remember to stay